Hi, this is Jackyln Brumwell, and I'm doing my Unit 5 skills validation. This is the room that in the hospital we're doing it in. There's nothing in here for me to cheat on. And these are my workbook pages that I completed. It's for chapter 34. Okay. This is my mom, Marcia. She's going to help us out again. Okay. So the first part of it was to teach the patient about using an inhaler. And what you'd want to do is have the patient either sitting or standing, and have the inhaler and shake it to make sure that the medication is mixed with the propellant in it. And hold the canister upright so that the medication, the bottom of it is pointing towards the ceiling. And then you would hold the mouthpiece 1 to 2 inches from their mouth and have them exhale. And then as soon as you squeeze down on the medication, you have them inhale and keep inhaling until they have a full breath, and then hold it for 10 seconds and then exhale. And if there's a second dose or a second spray that's needed, you would wait 1 minute before that was given. The next part of it was the transdermal patch, and you just want to make sure that it's placed in an area that has high circulation, like the chest or shoulders or upper arm, and make sure there's no hair, the skin is dry, and that every time the patch is applied that the sites are rotated to help prevent skin irritation. The next one is administering eye drops. And what you do, can you hand me the eye drops then? You'd have them sitting or in a reclining position, and you would get the medication and verify it, of course. Same with the transdermal patch or the inhaler. And you would have the patient look up towards the ceiling and then tilt their head towards the affected side. So we'll do her right eye. So she's tilted a little bit towards the right. And I'd have gloves on my hands, and I'd pull down the lower eyelid and insert the correct number of drops in the conjunctival sac right below the eye, making sure not to get it on the cornea. And then I would place my finger on the lacrimal duct to prevent systemic absorption of the medication. And I'd wash my hands and put the medication away. The next one would be eardrops, and you'd have the patient lie on their back or on their side with the affected ear pointing upwards. And you would pull the ear, the pinna back, upwards and back towards their head, and instill the medication into their external canal, and place a cotton swab or cotton ball there to prevent the medication from leaking or leaving the site. The next one is oral medications with the the MAR. Like, you take out the medications and you check the date of the drug, date and time of the drug, the dose, the route, and you check the dose, the drug, the date and time, and the route. And then after you put the extra medication away, you would check those again for the correct dose, the correct, like the expiration date and the time that's supposed to be given, the route, and then, why do I keep forgetting this? And the drug, I think is the other one. And then you would bring the MAR sheet, the medication administration record sheet, and the medication into the patient with water, and you would verify their name on their armband and ask, with the medication, and ask them to state their name. and then you would explain what you're going to be doing and let them know what medications you're going to be given at that time, and observe them take the medication. Well, actually, you would verify the medication again against the MAR for correct time, dose, drug, route, and patient. And observe them take the medication, offering them a glass of water. And you would check for any adverse reactions to previous medications or this one, and initial in the MAR that you gave it and sign in the MAR. And then for an oral suspension, the directions on the bottle state that you're supposed to give, for reconstitution, you're supposed to add 90 milliliters of distilled water and then shake vigorously. And in the assignment it says that we're supposed to make a dose for 600 milligrams 3 times a day. So you would, the bottle also says that it's 400 milligrams per 5 milliliters of solution of the drug. So in order to get 600 milligrams, it would be 600 milligrams is the desired dose, and the dose on hand would be 400 milligrams, and the quantity that we have is 5 milliliters. So you would take 600 divided by 400 and times it by 5, which would give you 7.5 milliliters is what this patient is supposed to get per dose. And I could only find the 3.5 milliliter syringe, so you would have a 10 milliliter syringe and fill it up to the 7.5 milliliter line and administer it to the patient that way, offering them a glass of water afterwards. And I think that's it. So, thanks.